Welcome to the RX class. I'm your host, Dr. Guang Chen. Recently, I sat down with a good friend and colleague, Dr. Lawrence Ong, to discuss a couple of aspects of allergy, which I'd always been interested in. I've known Lawrence for more than 10 years when we first started as basic physician trainees. We were in the same study group with two more others where we prepared thousands of hours before our basic physician's exam. Currently, Lawrence is a clinical immunologist and allergist in Sydney. He completed a Bachelor of Psychology before commencing medical school at the University of Sydney. After completing basic physician's training, he went on to complete advanced training in clinical immunology and allergy at St Vincent and Westmead Hospitals in Sydney. He was awarded a prestigious NHMRC scholarship to complete his PhD studies in the epigenetics of autoimmune disease. He's currently a Fellow of the Royal Australasian College of Physicians, a Fellow of the Royal College of Pathologists of Australasia, and a member of the Australasian Society for Clinical Immunology and Allergy. In this episode, we talk briefly about the immune system and a couple of examples of common allergies. A quick disclaimer before the episode. The information presented is general in nature and used at your own risk. Complex concepts may be oversimplified for entertainment purposes. Symptoms of medical conditions as well as diagnosis and treatment of these conditions may be discussed. The information presented do not constitute the practice of medicine nor replace medical advice from a licensed medical professional. Please do not rely on the information to make decisions about your or someone else's health. Please seek help from a certified health professional. Without further ado, please enjoy my conversation with Dr. Lawrence Ong. Thank you for coming on, Lawrence. It's a pleasure to have you talk about something that's very interesting and always evolving, allergies and immunology.
Yeah, thanks, Guang. Thanks for having me on. And I look forward to discussing some interesting areas in immunology and allergy with you.
Before we start, Lawrence, did you want to introduce yourself and to tell us a little bit about why you became an allergy or immunology specialist?
Yeah, sure. So my name's Lawrence Ong. So I work as a clinical immunologist and allergist. And so I've been working in this capacity for the best part of 7 years, if not maybe a bit more with the training. And so I guess I got into the area because I was most interested in I guess internal medicine rather than surgery, and then of those specialties in internal medicine, this was the one which I think most resonated with me in terms of the micro aspects of the work. So it's very much about things you can't see rather than things you can see, and then the complexity of it was really what drew me to the area, and the idea of working with immune cells and the immune system. So it's just the ideas within the topic area were quite interesting to me. And as I went along, the diseases that I learned about were also fascinating, and how these diseases come to be, and the mysteries surrounding that. Unfortunately, there's still a lot of mysteries there, despite what we know. But the exciting thing about this field is that it continues to develop very quickly, and it really is a big part of many organ systems in our body. So that's the other thing which makes it interesting. You're never confined specifically to one organ either.
Thank you so much for the lovely introduction, but I'd like to get into something a bit more meaty. Look, I've had these questions for a long time, and I thought, what better way to get it from a professional's point of view? So I'm going to give three examples that I've experienced both in my life and friends and family, and then we'll come back to the three examples to see if these are truly allergic reactions. So the first one, this is something that I haven't told many people, but ever since my late teens, I haven't been able to sit on grass at a park, and so I often wear long pants and a picnic rug, and people always look at me funny. And the reason for that is that whenever I do sit on the grass, it tends to be all grasses rather than a specific type of grass. I do get red, swollen patches, especially on my calves and thighs, and they can be quite irritating and itchy. So that's the first one. Second one, for many of you, at the moment, we're having a bit of a rainy spell in Sydney. There's been an increasing number of mosquito bites, and for whatever reason, I'm always a bit of a sucker for mosquito bites in the family. Um, I've always wanted to know, why certain mosquito bites are itchy and others are not. Is this an allergic reaction in any way? And lastly, I guess something very personal to my family. In the last few years, my daughter has developed an unusual, I guess, allergy to peanuts, in the sense that she was able to eat peanuts when she was younger, but as she's grown older, even the smallest amount of peanuts, she does get some itch and swelling around the lips and tongue. However, what is interesting is that peanut oil doesn't seem to cause this particular reaction. Only raw or cooked peanuts.
Yeah.
So maybe to kick off, maybe you can give us a really simplified way of understanding allergy and the immune system.
Yeah, sure. Look, those questions that you had, or the scenario is actually quite fascinating, and they're very common questions that I come across in clinical practice. So it would be good to flesh those out in a bit more detail later on. But yeah, sorry, back to your question at the moment. So about what is an allergy? Um, so yeah, look, allergy gets thrown around quite a fair bit as or colloquially as a term to describe adverse reactions, presumably to something foreign. Whether that's in the environment or whether it's been ingested. So yeah, look, that's a fair layperson's definition. But in terms of allergy in a medical setting, we generally consider it to be a reaction to something that's foreign, and that's usually benign. So these things aren't usually harmful. But in patients who have an allergic reaction, these otherwise benign substances then cause significant harm and discomfort and everything that goes with that. Um, we tend to conceptualize as something that involves the immune system. And I'll flesh that out in a bit more detail because it gets a little bit involved. But essentially, the immune system is evolved to fight foreign substances that are usually hostile, like bacteria, viruses, and fungi. Um, but in an allergy, these responses have become maladaptive or not so useful to us. Um, so I guess that brings us to the immune system, and this is a rather huge topic and a bit daunting in terms of describing this in a podcast. But to put it simply, as I said, it's there to defend against things in our environment that are hostile or potentially can cause disease. And we can think of it in various ways. So one of the ways I like to think of it is in terms of immune cells. So we have red blood cells and white blood cells in our blood, and as you all know, red blood cells are there to help carry oxygen, but white blood cells are part of the immune system to help defend us against those foreign bugs and bacteria and so on. So we've got that part of the immune system, and then we've got what we call the humoral immune system, which is all the other chemicals and factors that sit in our blood and circulate around our blood. So that's one way to think of it. Another way to think of it is the adaptive versus the immune response. So adaptive versus innate immune response. So the adaptive response is you can think of it as the immune system which learns and adapts to various sorts of foreign things. And then the innate system is there. It's a bit dumb for want of a better term. So it doesn't adapt. It just it's kind of constant, and often that's sort of as the first responder to anything that's foreign. Whereas the adaptive immune system can learn to recognize foreign things and prevent them from causing problems. So that's one way, or that's another way of thinking about the immune system. Um, because fundamentally, the immune system has the issue of trying to work out what is really benign and what's not going to cause us harm, and trying to distinguish that from things which potentially could cause us harm. And so that's the role of the immune system, and that can the the way that plays out can become a bit awry sometimes when we get problems with things like allergic reactions. So yeah, looking in short, that's a bit of an overview of the immune system. So just to recap, you've got kind of cells versus other, I guess, things that float around your blood that aren't cellular, like things like antibodies and various proteins that help to fight infection. And then you've got the adaptive, which can learn about new bugs, viruses, and so on, versus the innate immune system, which just has a single response. It's always the same.
So the adaptive is how immunization works. Is that right? The vaccination, so that we trick the immune system into thinking that we've been exposed, and then hopefully later on, if the actual disease comes along, we've got some sort of protection.
Exactly, Guang. So that's the classical example used to talk about the adaptive immune system. So you get influenza vaccine, so seasonal influenza vaccine, and your cells learn to recognize this vaccine. And so when you get the actual flu virus that's spread to you by a passerby on the street or a family member, that the body can ramp up its response to that virus much more quickly, and this is typically in the form of antibodies. So we're trying as you say, trick the body into producing antibodies against the actual virus by giving either dead virus or other components of virus or some sort of virus so that it has something to learn for a subsequent exposure.
And so, what about if I get a cut on my hand? Which part of the immune system gets activated in that way? If I, get a bit of dirt as I'm doing some gardening.
Sure, sure. So yeah, look, if you get cut, there's local signals from the cut itself. So where the tissue is from the cells, they uh, secrete signals to the innate immune system. So these are, I guess, dumb cells, for example, so neutrophils. So they come by, and they're the first responders. So they're good at eating up or engulfing foreign bacteria or other bugs. And yeah, so they're kind of the initial responders. That's where you get the inflammation. So that's where it becomes hot, swollen, painful because of those first responders and the chemical messengers that are there. And then over time, that inflammatory response will wane. So the body will signal that yep, okay, you've done your job, and then there's a regeneration. What happens in terms of cells coming to repair the damage um, and heal you up, and that's where you get the scab formation and so on. So yeah, so that's an example of where the adaptive immune system is the primary um, mechanism in terms of how the immune system's working.
Oh, thank you for the excellent explanation. So perhaps then maybe we go through the three examples and then see well, what's actually happening on a immune system level or what's contributing to the various symptoms that that I was experiencing. So, for example, well, let's go back to the first thing that I described. That look, when I go to the park, why is it that when I sit on grass that I get these red itchy patches, which the medical term is really urticaria, which stands for, I guess, redness or swelling.
Yeah, that's right. So I guess one thing which we can talk about, which might be helpful, is what's happening in an allergic reaction. So I said it's an immune response to something that's usually benign in the environment or something you've ingested. So with an allergic reaction, we produce antibodies as we discussed with the vaccination example. But in allergies or allergic reactions, the antibody you produce is an antibody called IgE. And this antibody was historically important in fighting parasitic infections. But for some reason, we haven't fully understood why yet. We start producing this to various things that trigger allergic problems. So, peanuts, for example, is classical, or with hay fever, it may be, dust mite, for example. And so when we encounter these things, it causes the triggering of an allergy cell through this IgE. And the allergy cells I'm talking about are what we call mast cells or basophils. And then that's how you get an allergic reaction. So these cells activate and they trigger all the symptoms that we typically associate with an allergy. So that brings us to your question about the urticaria. So so what you've described there is a contact urticaria. So when you sit on grass and you develop colloquially hives on the legs, which are quite itchy and can be quite distressing. And so this is one common thing, and patients say, "Oh, look, I'm just allergic to grass." And so in some cases, this is what we call IgE mediated, so it is related to the immune system. But in a large proportion of cases, they're not necessarily IgE mediated, and it may be that the cells that are responsible for, like I said before, the mast cells and the basophils that are what we call the cellular component of this reaction are being activated directly. So it's not clear cut, but what we do know is that essentially the cells which are responsible for allergic reactions, the mast cells, regardless of whether it's activated by the antibody IgE or not, when you have this urticaria, it's getting activated. So it might be a bit of a complex answer to what was otherwise quite simple. I guess you can say it is, in a sense, a typical allergic reaction, and it can also be a not your typical allergic reaction. Um, let me know if you want to clarify that.
No, no. So how do I guess, reduce it or prevent it other than wearing long pants and not going out to the park?
Sure. So look, there's no good treatment here which will cure you of this condition. So usually, most patients will have antihistamines and they'll find that it settles down with time. But unfortunately, like with a lot of reactions of this type and with other allergic reactions, there is no good treatment in terms of a cure. It's mainly about avoidance or symptomatic treatment.
And would these things get worse with repeated exposure?
Yeah. So this one is it's I guess in on the whole, it's not something that tends to affect other parts of the body that are not in contact. So it is very much a contact reaction, and we generally don't consider those to be serious. So it's not something where you can have a severe allergic reaction like an anaphylaxis, where you might have a become dizzy or become short of breath. It's very much just in the area. So as distressing it can be, it generally won't progress to anything more severe just than just a skin reaction.
Oh, great. That's very reassuring.
But I still wouldn't roll on grass if I were you, Glenn.
No, no, I haven't done that for more than 30 years, I think. So next, look, the mosquito bite. That's again a very interesting, um, I guess, topic. Look again for many people who might not know, apparently the only female mosquito bite. Only the female mosquitoes feed, especially at the time of mating and obviously egg production, and they've got some very sophisticated proboscis which pierces the skin and at the same time, to my understanding, releases multiple chemicals to essentially prevent the blood from clotting and perhaps even draw the blood closer to the surface to obviously allow them to feed more effectively. But again, I've always wondered why certain mosquito bites are itchier than others, and why you know maybe the separate question why some people get bitten more than others, which is maybe not related to the immune system.
So mosquitoes are fascinating, aren't they? They can bite us without us even knowing until well after the fact. And they do, I think they do secrete a numbing agent or something, and they actually can actually um, put that on the surface of the skin before they go in, so you don't actually feel them biting, which is to their benefit. Um, but yeah, look, another common question is, why do I get such big swelling with mosquito bites, and is it an allergic reaction? Look, we don't classify the large reactions to mosquito bites as allergic in nature. So it is the body's reaction to a foreign substance, but it's not mediated by the immune system in the same way that a classical allergic reaction is. So there's no need for things like EpiPens and so on. But we can dampen down the inflammation that's associated with that with steroids. Yeah, but it's not dangerous in the sense, of having like an anaphylaxis or anything like that, and it's not your typical allergic reaction. So your listeners might be happy to know that we wouldn't expect it to progress to anything worse than just an uncomfortable and itchy area.
Great. So then, lastly, I guess, yeah, coming to the uh, particular reaction that I guess my daughter has, and I guess many young children and adults have, which is a peanut allergy. And as I said, it has evolved over the last few years, which was again unusual when she was able to eat peanuts when she was much younger. And it does appear that she's becoming more and more sensitive, and she can literally pick up uh, the smallest amount of of peanut sauce or crushed peanuts, even though it's yeah, obviously not visible to the naked eye.
Yeah, look, it's definitely very anxiety provoking, especially in patients who are much more sensitive, and it can evolve over time as well. So it's very hard to know, even if reactions have been mild in the past, whether they're going to become more severe in the future. That is one of the common questions I get. Will this reaction become worse? And it's really hard to predict. And so generally, if you have been diagnosed with an allergy, it's a good idea to continue to avoid it, regardless of whether it's been mild or more severe. Yeah, so this reaction is the more classical allergic type reaction where we get IgE involved, as I described before. So you're getting the Ig, it triggers the mast cells, which then and basophils, which then release chemical mediators that cause all the symptoms. So these are things like histamine, which make you become itchy, have hives, give you the swellings. But that can also lead to, but there's also many other chemical mediators which trigger things like low blood pressure, and in some patients, asthma and shortness of breath as well. So yeah, so that is a more classical allergic reaction. And the fascinating thing about it is that we still don't fully understand why there's such a epidemic, particularly where we are in Australia and also in places like New Zealand. We, given that it's a location, seems to be very much tied to location. We suspect there's a big environmental component, and so with particularly with people from say who've migrated here, either first or second generation, really recognise that there's such a big increased prevalence of allergic diseases in these people. And we still don't fully understand the connection, which is really fascinating. And hopefully, we'll find out soon as to what factors really influence the development of allergic conditions. And this goes to other allergy related conditions, or what we call atopic disease. These include conditions like asthma and eczema and hay fever. Um, so yeah, those are just some points about peanut allergy. There's there are other aspects to it as well. So I guess why is peanut specifically, as opposed to other tree nuts, for example, and that's also an interesting question. But what we think that we tend to be allergic to is the protein. So something about the protein within peanut that appears to be very allergenic. And I think your other question was about why the other thing about your daughter was about why she's
Peanut oil,
allergic to
yeah, to
to
peanuts,
allergic
but not
to
peanut
peanut oil.
oil.
Yeah, correct. And so we know that you can be allergic to different components of the peanut. So there's different proteins, and they serve different functions within the peanut. And not just because you're allergic to peanut doesn't mean you're allergic to every component of the peanut. So it may be that there are components in the solids of peanut which aren't in peanut oil, that seem to cause your daughter problems.
Oh, no, thank you very much. It's again great to understand it from an allergy perspective. Look, while we've got good, while we're running well on time, perhaps the other thing I guess I wanted to ask about was allergy testing. So, look, in my daughter's case, it's clear that she has a peanut allergy, and would she benefit from formal testing, or that would be something that will be mainly reserved for if you're unclear of what particular allergen or trigger that that's triggering the allergic reaction.
Mm. Yeah, good question. So with food allergies, it's always good to confirm it with the allergist and also with allergy testing. The reason why is that sometimes it may not be clear cut. I mean, in the case of peanut allergy, it's been quite reliable. And even clinically, we could potentially diagnose it, but it's always nice to get that testing just to be sure. Um, a big I guess, misconception is that allergy testing is the be all and end all in terms of diagnosis, but it really isn't. It's only a tool and it's not 100% specific, right? So even someone comes up positive does not necessarily mean they'll have a clinical reaction. And so it's actually quite important to put these various aspects together. The other reason why having an allergy test may be or is important is that often patients are what we call co-sensitized, or they're not only sensitive to one nut, but they tend to be sensitized to other nuts as well. So for that reason, it's also worthwhile considering testing. And as I mentioned before, patients with food allergy may also have other diseases like asthma, eczema, and hay fever. And having an allergy expert assess your child or a patient with a food allergy can be useful from that point of view as well. Because often, particularly in children, they're unaware that they might have other symptoms of these conditions.
Can you tell us a bit about how the tests are done? Is it a blood test, or is it? I hear you can do skin prick testing.
Yeah, sure. So, yeah, there's a few different ways we can test for allergies. So, as you mentioned, the blood test. I guess it was traditionally called a RAS test, and we can do that to various foods if that's the concern. It's good. It can be very helpful. Sometimes there can be. It's always good to consider doing both that and the prick test because they can give us extra information. The prick test is obviously done on the skin, so we use an extract of the allergen and scratch the surface of the skin, and typically it takes about 15 to 20 minutes before we get an answer. And So depending on the size of, basically the patient may develop something that looks like a mosquito bite in terms of a lump, and that can help guide us as to maybe how likely someone is to react to an allergen if they're exposed. So yeah, look, both of those are valid ways to help us diagnose a allergy, and they're both pretty straightforward. Obviously, with the skin testing, there's a little bit of discomfort there, but it's usually not terrible and doesn't take too long.
And would you do? I mean, with the skin prick, would you normally just do? I guess one particular food, or you would do a panel of tests, or how does it normally work?
Yeah, sure. So it depends on the clinical scenario. So, often patients, particularly if they're young children, they've had a reaction to something quite clearly, and the parents might be suspicious that they've had another food and also had maybe an itchy mouth or slight lip swelling, and so often we'll end up doing more than one allergen. We know that there are some nuts and some other foods like seafoods where there's what we call cross-reactivity. So if you're allergic to one, there's a good chance you're allergic to another one. And so for that reason, we may end up doing some panels as well. And of course, if someone's got a food allergy and they've also got symptoms suggestive of hay fever or asthma, we may well go ahead and do testing to environmental allergens as well. So things like dust mites, grass pollens, tree pollens, molds, animal danders. Um, so yeah, it's not clear cut, but there's reasons why we might do some panels or at least suggest panel testing.
Okay, and what about the patch testing? Is there a type of, rather than skin prick, there's patch testing, or there's or similar or different?
Yeah, right. So patch testing is used to test for a condition called contact dermatitis, and we might think of it as allergic, but the mechanism is a bit different. So I talked about cell-mediated immunity, and this is very much a cell-mediated reaction. So that test is, as I said, done for contact dermatitis, and it involves a patch typically placed on the back. and it's left there for a couple of days and then removed, and we watch the evolution of a reaction. So typically patients end up with redness and itchiness and swelling of the area, and the patch will contain different chemicals, or substances, and depending on the reaction, then we can determine whether someone is likely to develop contact dermatitis to that substance or not. So this becomes useful for example, some patients might get contact dermatitis with particular jewelries, could be hair dyes, it could be cosmetics, and other sorts of substances. But the contact dermatitis doesn't typically end up with, features of shortness of breath or dizziness or hives or swelling. So that's, very different um, from the food allergies and hay fever that we were discussing before.
Ah, yes. And what about, I guess, in terms of the interpretation of these results? You said that obviously these have to be interpreted individually. I guess what is common in medicine is that perhaps, we've got one patient that fits a particular syndrome, but their tests may be negative, or vice versa. And how do you cope, or how do you deal with that? As for example, with my daughter, if she was theoretically to go and have the skin prick test, but if that came back negative, does that mean that she doesn't have a peanut allergy?
Yeah, sure. So, there are ways which we manage things like that, because there can be lots of reasons why an allergy test might come back negative, and so I guess it really comes back down to how likely we think the initial reaction was a allergic reaction. And that brings me to the other point. So the other reason why it's important to seek some expert help is, to get the necessary treatment and have the necessary precautions implemented, and education about, what to look out for in terms of an allergic reaction, and how to manage allergic symptoms. So a negative test doesn't necessarily rule out an allergic reaction, but yeah, look, in many cases, patients will be suspicious. We do the testing that's negative, and sometimes we can conduct what we call an oral challenge, where we actually give patients a bit of the allergen they're allergic to under supervision. So it's a very, I guess, um, um, a structured protocol as to how we do that, and obviously has to be done in a setting where there's facilities able to treat reactions as well. So that's something which can happen, and over time, patients can also lose sensitivity to food allergens, and so that's another reason why we may consider doing an oral challenge.
Oh, interesting. So I guess potentially people could grow out of their allergies, but it's, I presume the underlying mechanism is still not well understood.
Exactly, yeah. So, why they regress over time is unclear, and why they develop as well. So, it's unusual to develop certain food allergies as an adult, but we know that adults can develop them, even though we tend to see them more commonly in childhood. So that's not very well understood either.
Well, thank you so much, Lawrence. I learned so much in the last half hour. But look, I guess to finish off, I'd like to ask, what do you see that's evolving in allergy immunology at the moment, and what's really exciting you? And where do you see, this field heading in the next 5, 10 years?
Yeah, good question, Guang. Uh, Look, I guess, with the whole AI revolution, it'll be interesting to see how this all develops, and how we come to understand immune and allergic disease. The possibilities just seem endless at the moment in terms of diagnostics, prognostication. So working out where patients will end up in terms of their disease, and also what treatments are most appropriate. We're starting to understand that there's huge differences between people, even with the same disease, and how that disease responds to treatment. So AI is going to be part of this revolution. Um, in terms of other areas, so there has been a lot of progress as well in genetic sequencing. We're coming up with breakthroughs all the time in terms of how we link our genetics to development disease. So further understanding this as the technology becomes cheaper and cheaper to implement will be a big step for the field. So yeah, look, those are just my views on where I think things are headed. But I think it's not only in immunology, but in so many areas of medicine. But immunology stands to benefit a lot, I think, from these advances.
Oh, definitely. I can't wait to see what's going to happen in the next 5, 10 years.
Yes, it will be exciting.
Hope you enjoyed the episode with Dr. Lawrence Ong. As always, if you've enjoyed the episode or the podcast, please give us a 5-star rating on your local podcast player. If you do use Spotify, you can connect with us directly, or you can always reach out to us online or via social media. Until next time.